Hello, everyone. Um, Today we're going to be talking about pre-diabetes. And 9 out of 10 people that have pre-diabetes don't even know they have it. 88 million people in the United States have pre-diabetes. Adults 18 and older have pre-diabetes. But today what I want to talk about is the fact that it can be reversed. So that's number one, it can be reversed. And number two, it's worth reversing, okay? So I'm going to talk more about that shortly, but let me first welcome you to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a primary care doctor and owner of In Touch Primary Care in Sugar Land, Texas. And I am so excited you're here. This is the place to be if you desire to take charge of your health and you want to do all that you can to live a healthy lifestyle. So you can listen to this episode and all of our other episodes on In Touch Primary Care YouTube channel. Go ahead and share it, leave comments, and subscribe to our YouTube channel. So pre-diabetes. So I mentioned just a few minutes ago, 9 out of 10 people that have pre-diabetes don't even know they have it. And it's really, really easy to find out. It's really just a blood test. By doing a blood test, you can find out whether or not you have pre-diabetes or diabetes. And that's really important to know. The blood test usually checks your glucose level, which can be done fasting. So if you haven't eaten for 8 hours and then they check the levels, if your fasting blood sugar is 100 to 125, that's suggestive of prediabetes. Okay, so that's one way to check. The other test that can be done is called a hemoglobin A1C. And that test, if the values are 5.7 to 6.4, then that's considered prediabetes. If it's higher than 6.4, then that's diabetes. But it's really important to know because there's something we can do about it. It can be reversed. So it's so important to know. If you know, then you can do something about it. 15 to 30% of people that have prediabetes will develop diabetes within 5 years. So up to a third of people that currently have prediabetes, if nothing is done, in 5 years, they'll have diabetes. And why do we care, right? What's the big deal? Well, we know that people that have diabetes are 3 to 4 times more likely to have a heart attack. They're also at higher risk of a stroke. And if diabetes is not controlled, it can also cause kidney failure, can lead to blindness, it can cause nerve damage. So there are very serious health consequences of diabetes, and that's apart from the financial burden that it puts on people, the time burden of making sure that you have to see a doctor and check all your levels. So there's a lot that goes into it. So if we can prevent it, it's certainly worth preventing. So let's talk a little bit more. So you may have heard of diabetes or prediabetes, but you don't really understand it. Or maybe you've been diagnosed with prediabetes in the past and you don't really know what to do. So let's kind of back up a little bit and talk about what's really happening in the body. So usually when you eat something, especially when you eat carbs, right? So all carbs are broken into glucose, which is a type of sugar. So when you eat carbs, which a lot of our diet, because carbs give us energy, carbs are broken down a lot faster than proteins and fats. So we eat carbs to get energy. That's what's supposed to happen. However, in order for that to happen, there's a very important hormone called insulin. Okay, so this hormone called insulin is produced in an organ called the pancreas in our stomach, right? So we have a pancreas in our abdomen that has these cells that produce an insulin, and this insulin is what is supposed to carry the glucose from the food into the cell. So if the glucose stays in the blood, nothing happens, no energy, just causes havoc. But if that glucose can get into the cell, if the insulin can get it into the cell, yay, we're happy, we have energy, we have mental clarity, we can do what we need to do. So what's happening in people that have prediabetes and diabetes is there are things making that, stopping that process from happening. So one of the things is that the cells that are supposed to be producing insulin may not be functioning properly. Okay, so that could be because they're dying, and we'll talk about what caused them to die, or that could be because they're just not they're not functioning at their highest capacity. They're not dying yet, but they're dying, but not dead yet. So that's one reason. So those cells are supposed to be producing this hormone that's supposed to get the glucose into the cells, but it's just not producing enough of it. So that's one reason. The other reason, though, is that even though insulin is being produced, the body is resisting the action of the insulin. So there are things happening in the body that is causing the insulin not to be as effective. And that's what we mean by insulin resistance. The body is resisting the action of the insulin. So you can see how that can cause a problem, right? Here's the glucose trying to get into the cell so that you can have energy, but you don't have enough of that insulin to get it inside the cell, or you have some of that insulin, but the insulin you have is just, the body is not working well with it and is resisting that insulin. So those are the major reasons why people will develop high blood sugar. So too much sugar in the blood because it's not getting into the cells for the reasons that we talked about. Now, the thing that makes it a little bit more why diabetes can occur easily is because when the blood sugar is high, that's one of the things that actually kills those cells. So you can see it's a vicious cycle. High blood sugar over time will kill those cells and prevent them from producing insulin properly. So, it's like a double-edged sword, right? So that's one thing. The other thing is inflammation in the body, as well as high cholesterol, also affects those beta cells. So you may have noticed that a lot of people tend to have, some of these conditions together: diabetes, high cholesterol, sometimes high blood pressure. And that's because a lot of the same things happening in the body cause these conditions. And so if we can change some of these things in the body, a lot of those conditions also get better. Okay, so with prediabetes, those cells, our goal, in order to reverse it, we need to do a couple of things. Number one, we need to lower that insulin resistance, make the body more happier to accept the action of the insulin. And number two, we're trying to preserve those beta cells so that they don't die, because once they die, there's no way to reverse that. Once they're gone, they're gone. So we want to preserve those beta cells so that they can continue to produce enough insulin and prevent diabetes. So we know that by the time a person has been found to have high blood sugar, that the insulin that they have, they're only producing insulin at 50% or less capacity already. So by the time we're saying, oh, your fasting blood sugar is high, their capacity has already been reduced. So it's really important that the earlier we address it, we can stop the betas. We can prevent worsening of the death of the beta cells, basically. So we need to act early, and that's why prediabetes is so important to address. So I see prediabetes as a great opportunity. I mean, once you're diagnosed, this is a great opportunity to do something now, because it can be reversed. Okay, so who gets prediabetes? So you might be thinking, well, I'm healthy. I don't have any symptoms. I don't think I have prediabetes. Well, the only way to know is to check. It's very, very common. And there's so many factors that can affect it. Just generally speaking, it's genetics can be a factor. Even lifestyle definitely is a factor, your diet, your stress level, exercise, and then your environment, including your body's environment. The bacteria in your gut can also predispose you, or can also affect your risks of diabetes, or prediabetes. So there are many things at play here. that we don't have time to get into today. But the point is, doesn't matter what they are, there's something we can do about it. Okay, so you've been listening, you're saying, okay, I have prediabetes, what should I do? What can I do? Before we get into that, I just want to mention, if you have already been diagnosed with prediabetes, don't ignore it. Okay, there is something that can be done, and the sooner the better. Your blood test should be checked at least once a year, just to confirm that you're going in the right direction. So as I mentioned, 15 to 30% of people diagnosed will actually develop diabetes within 5 years. And you want to know that. You want to know whether or not it's whatever you're doing is working. So you don't want to delay your care. All right, so what can you do? I'm going to focus mainly on what you can do with your diet, because I think that's what can give the biggest significant change and also can affect your lifestyle and your health in general. So let's talk about, when I talk about what you can do with your diet, I'm thinking about it with the food groups, okay? So carbs, proteins, and fats, right? So let's talk about carbs. I know a lot of people, when they talk about carbs and diabetes, they just say, oh, no, you can't eat any carbs. And that is not necessarily true. We need carbs for energy. And so you do need to eat carbs. It's just the type of carbs that are important. So you want to get most of your carbs from vegetables, especially, and some fruit. So you can eat all the carbs you want from vegetables, and that's good. You also want to go towards whole grains in terms of carbs, right? So you want to substitute processed foods for whole grain carbs. So for example, brown rice, whole oats, quinoa, whole grain bread, things like that. So you want to substitute your processed carbs for whole grain and vegetables and fruits. So that's with carbs. You can have carbs, but the type of carbs matter. And then definitely avoid the processed carbs. And we say avoid the processed carbs because those processed carbs tend to have fats and sugar and salt, and all those things contribute to inflammation in the body, which increases the insulin resistance. So it makes your body less receptive to the action of the insulin, and we don't want that, right? So that's the first thing you can do. The second thing in terms of diet is the fats, right? So a lot of times people think, oh, fats are bad, don't eat any fats. But there are actually some good fats that we encourage you to eat if you have been diagnosed with prediabetes. And these are fats that contain omega-3 fatty acids, especially EPA and DHA. And it's best to get these from food. I know there are tons of supplements out there, but there are tons of foods out there too that have these in abundance. So fatty fish like salmon, tuna, sardines are good sources of polyunsaturated fats, which is omega-3 fatty acids. So you could eat those. Nuts and seeds, especially flaxseed, chia seeds, walnuts, those would be good. Nuts and seeds, plant oils like soybean oil. Those are good examples of or flaxseed oil you can incorporate into your diet, and that's great for the type of fat that you want to incorporate in your diet for prediabetes. Now, the other type of fat, the saturated fat, that type of fat is not good for prediabetes, and I think that hasn't actually gotten as much attention as it needs. So when people have diabetes or prediabetes, we talk a lot about carbs and, don't eat processed carbs and that sort of thing. But we don't talk enough about avoiding saturated fats as well. So saturated fats are fats found typically in animal protein, especially red meat, but just meat in general. Also, you can find saturated fat in like cheese, baked goods, fried foods, and those are also not good for the glucose metabolism. So if you have prediabetes, you want to limit saturated fats as much as possible. Try to limit the amount of meat you're eating. Substitute that with fish, as we talked about. Try to limit cheese and baked goods and fried foods, because that also contributes to insulin resistance, because those fats get deposited in different parts of the body and can contribute to insulin resistance. So that's the other group of food. We talked about carbs. You can eat carbs, the good carbs, vegetables, fruits, and whole grains. You can eat fats, the fatty fish, nuts, and seeds. Now, protein, for protein, what we say is substitute animal protein for plant protein. So beans, legumes, peas, that sort of thing, you want to substitute you want to eat those type of proteins instead of animal protein, so you can get your protein, because protein are important for amino acids, right? We need to have that as well. So we talk about carbs, we talked about fats, and we talked about protein. So those are important food groups, and it's important that you're getting foods from all those food groups. But in order to prevent or reverse, to prevent diabetes or reverse prediabetes or reverse prediabetes, it's important to eat the foods in that specific foods in that group that will make that possible. Awesome. So I hope that helps. If you're in the Houston area and you're looking for a doctor who is going to be proactive with your care, check us out at In Touch Primary Care. We do things very differently. We have the practice set up so that you can spend time with your doctor. We have it so that our patients can reach us easily and they don't have to delay care. So we can actually see you even if you don't have health insurance. So you can learn more about us on our website, intouchprimarycare.com, intouch.com, and you can learn about how we work. So again, prediabetes is reversible. Prediabetes is worth reversing because the implications are so many and the benefits are huge. I mean, making dietary changes, as we discussed just now, will not only benefit you in terms of preventing prediabetes, also benefits you in terms of your lifestyle in general. It's going to make you have more energy, better mood, mental clarity, and it will definitely save you a lot of time and money with going to the doctor in the long run. So if you know anyone that has prediabetes, please share this episode with them. And otherwise, I will see you next Wednesday at 2:15 p.m. Thanks for joining. Have a great day.